Yeah, we actually immediately in the first year of adopting it actually reduced our employees' deductibles by 40%. Their maximum amount of pocket costs were significantly reduced. And not everybody experiences that, but for those that do experience
Of course,
it,
yeah.
it's a big deal.
All right, hey guys, Spencer Smith. I'm here at the medTRANS annual conference in beautiful, balmy San Antonio. It's like 85 degrees, and I've got this jacket on, and I'm sitting with
Lew Walde with Timberline Drilling.
Hey, Lou. Well, so Lou, I appreciate you sitting down. I know we wanted to have a short form conversation, but to get a little bit about your experience with medTRANS and some of the transition, what you guys were doing before. So real quick though, why don't you tell me about your company and what you guys do?
Yeah, Timberline Drilling is a core drilling contractor. We specialize in deep hole drilling for hard rock mining companies, primarily in the western United States and more recently out in the Minnesota, Michigan area. So
Okay.
pretty
Because they
excited
need
about
some
that.
drilling too, right?
That's right.
But you said you were based in Coeur d'Alene,
Coeur
right?
d'Alene, Idaho.
Okay,
Yep.
the hidden gem, right? Like we don't want to talk about it. We don't want it to be too popular nowadays,
right.
Yeah. So talk to me a little bit about your experience with medTRANS. What were you guys doing from like a health plan perspective before you got in touch with medTRANS?
You know, were basically had been a fully insured plan. We then went into a sort of a min-max program, back to fully insured, then sort of level funded plan. But as we continue to grow, we always sort of had this view that we would go out and eventually try to get into this more self-insured model.
Because you said you had some background in it, right? Or you had previous
I previously
experience?
worked with a previous employer that was a self-insured entity for medical.
Okay. But all those transitions, you mentioned a couple fully insured and level funded, now medTRANS, was that intentional or were you just looking for solutions at that time?
You know, I think it was intentional in the fact that, you know, some of these other programs, you were taking on some level of risk, but some level of opportunity.
Okay.
But at the long game really wasn't the right answer.
Okay. And how you said you're about 300 employees?
350 plus employees.
So once you figured out ultimately that, and with your background in self-funding, ultimately it looked like a captive arrangement might be the most appropriate option. Talk to me about that transition. Like what does it look like were you level funded at the time that you transitioned or fully insured?
I think we were using a level funded program at that point in time.
And then so you made that decision. Talk to me about the transition. What was the experience as an employer like?
Yeah, we were able to, one of our consultants brought the concept up to us. He had met with Phil previously, had actually placed another employer with medTRANS.
Okay.
So they had some prior experience. Went through that process with them. We racked our heads around it a little bit and said, hey, okay, you know what? This thing actually makes sense because we were tired of really going through the annual renewal process.
Yeah.
We were getting all these quotes, going back and forth, back and forth. This provided us with an opportunity to maybe control more of the elements ourselves.
Well, did you have a learning curve though? Because this is sometimes I think a misconception about captives, right? They're too difficult to understand. There's a lot of moving parts, but did you feel like it took a couple conversations with Phil and his team before you got it?
Oh yeah, absolutely.
Okay.
You know, we had some calls with Phil. He came to our office before we ever signed up. It was always, reviewing the steps, making sure everything was done the right way. Because there's some questions about
regulations,
IRS, regulations, IRS, and.
But once you got your head wrapped around it and it made sense, you guys said, let's go, let's do this. What was the experience like that first year? Like, was it everything that you expected it to be? We got into it the first year and we really had no problems. I mean, there's a few, the new TPA. Sure. You got some coordination, right? You got vendors and stuff like that, yeah.
For the most part, it worked very, very well. And then come time to renew for the next year, simple. Great, easy.
Well, that's one of the things you're buying, right? The stability of the captive, not only in stability of your risk management over time, but the stability in the actual vehicle of risk management itself. So how, like when you went to that first renewal, I assume it's probably a pretty palatable number, or was it even a flat renewal that you experienced that first year?
Essentially flat on our first one. And plus, you get the captive, so you're getting some savings within that captive. And we've been able to enhance our benefits to our employees with some of that.
Well,
savings.
so I'm glad you said that, right? A lot of people go into self-insurance and go, well, hey, I want to save some money. That's what I need to do. I need to save money on my health plan. There is this misconception, I think, that means, well, your benefits can't improve simultaneously. So you're saying you were able to save money over the long term, but also improve your benefits. So what did that look like?
Yeah, we actually immediately in the first year of adopting it actually reduced our employees' deductibles by 40%.
40%. Well, I'm sure. So you had some happy employees, I presume.
Yeah, so
right?
it's, their maximum out-of-pocket costs were significantly reduced. And not everybody experiences that, but for those that do experience
course,
it,
yeah.
it's a big deal.
When you've been able, you said also to hold premiums stable for the employee over the 4-year period.
4-year period, we have not increased the share of the employee's contribution at all.
Okay. Well, so 4 years, stable premium, better benefits. I'm sure your bottom line has benefited as well. But has there been any downsides? Has there been any experiences that were like, oh, we had a bad claims year or something like that?
We actually did have a bad claim year. With 2 or 3 of our claims went over our sort of our defined maximum. So there was some, we did eat some of those costs, but it's all part of the plan. And that, over time you're going to benefit, but you're going to have those 1 or 2 years that you don't necessarily do as well. But there's protections on top of that, so you're prevented from really taking it.
Well, it's not to suggest you go into a captive and your risk goes away, right? There's other things you do around cost containment and preventing, things from occurring, but you have the stop loss, you have the reinsurance, you have the captive arrangements set up to manage that risk in the event that something happens. So even though you had that bad year, what does that look like in context to maybe if you'd stayed fully insured for the past 4 years? It's hard to say, but presuming, right?
I think if you think about the employee side of it, right? If we would have had that bad year with a fully funded plan, our premiums probably would have went up 15 or 25%, which then we would have had to pass some of that cost on to our employees. So our employees are benefiting from this program.
Well, and then, or there's also the evaluation, well, maybe we need to reduce the quality of the benefits in order to manage the cost, which nobody wants to do that. But what about kind of the vendor side, right? Because within the medTRANS arrangement, my understanding is you can change vendors throughout the years, make these little fine tunes that happen. So have you been able to do some of that within the last 4 years as well?
Yeah, we were fortunate to pick great vendors to start with, and we've maintained those, but we've recently added another one called Sharks, which is really helping us.
Do you know, can you explain what they do? I don't know.
Sharks is here to try to help your high-cost prescription users find alternative solutions that will not only save them money out of their pocket, but also to save the company. And so they're working hard at it, and
cool.
I think so far their success has been good.
Well, that's one of the beautiful things about self-funding, not just within a captive, but even like being self-funded on your own, is that ability to carve out the TPA or the PBM or your stop loss carrier and all these other cool things. And if you decide, well, we've had less than stellar outcomes with that particular vendor, you don't have to make this sweeping change. It's not like moving from one fully insured carrier to another and you have all this disruption. It's literally like, no, that didn't work. Let's just tweak that one thing, but let's minimize disruption overall. And so I guess you probably experienced it.
Spencer, you're absolutely correct on that.
Yeah. Well, I've been doing this a while, so I'm glad you say that, but I appreciate it, man. So we've probably been talking 8-10 minutes or so far, but why don't you tell me what is something that you would want to convey to another employer that's considering doing this but aren't quite sure yet? What would you say to them? Well,
I think the mid-market companies, 100 plus employees, the math just works, right? And you're getting a great support team of people. I mean, I've learned so much just here at this annual meeting this week, right? And finding new opportunities. And all these companies that are part of it are working together to try to control our medical costs, and we're learning from each other. So it's great.
Well, that's the amazing thing that I've only kind of been made aware of the culture of the folks that are within captives, and I didn't realize there's so much collaboration, that you have these events, semi-annual or annual events, where everybody gets together and talks about, hey, what are you doing? Like, what are you doing for RX? And you share those things together rather than be like, I don't want to tell anybody because they're competitors. There's this openness about this. So have you experienced that being a part of this?
Yeah, I would not say that we're competitors. I would say we're partners.
Yeah. Well, because you all are technically partners. You have skin in the game together, right? And you want everybody to benefit alongside you. So closing thoughts real quick. Anything you want to say before I let you go and you get out of the hot seat of the podcast?
Yeah, no, thanks, Spencer. And, medTRANS is a great organization to work with, captive management. helps us make sure everything's in order, and we've got great partners out there.
Shout out to Phil, right?
All right.
All right. I appreciate it. Thanks so much for joining.
Thank you, Phil.
All right.
Thank you, Spencer.
That's all right.